and Cosmetric Center. A very special welcome to our chief guest, Mr. யலளற, a well-known person. The main environmental factors are taking a toll on our lives every day.
Until this morning, I was trying to get out of coming here simply because I'm not feeling too well. And Anusha said, no, you have to come. You have to be here. And then she enticed me by talking about this gold standard, rejuvenating, high-tech machine that has been brought by the Nawaloka hospitals. And this is going to be a state-of-the-art skincare and cosmetic center. Something that is much needed, because I know the able and the people who can afford it would go to Singapore, India, some of them would go to England. But what a treat. I was going through the list of things that we could look forward to. Crow's feet, the bunny lines, taking away the pigmentations, and hair removal, pain-free skin rejuvenation. Of course, Ruki immediately asked me what is this pain-free rejuvenation is all about. I am looking forward to listening to all of you, the experts.
From villages, from towns and cities, both male and female, ever so interested in their appearance. You can see the so-called unauthorized skin clinics and the mushrooming in every corner.
Treatments available like creams, gels and lotions, they would pick out what is best for that skin condition. But things are changing now. Everyone's dream is to have more beautiful, glowing skin like this. So with has no imperfections and no blemishes and no scars. So with this same in mind, more and more people are now seeking dermatologist advice for routine skincare and for skin imperfections like acne, pigmentation, excessive hair, scars or stretch marks, or even thread veins. The dermatologist will know when to intervene and when to look for internal problems. And also what we practice is evidence-based medicine. So all the treatments that we are doing are being researched in a scientific manner worldwide. Even the normal sites like armpits can be treated with the same laser. And it's not only for the females, even men can use this laser for certain sites. And tattoo removal. This is again another indication where lasers can be used very effectively. Once a tattoo can be done as a fashion, but years later you might want to get rid of it. Then the lasers would be the answer. Again, for pigmentation, as with any other procedures and other treatments, in combination we can use lasers as well. Then various kinds of birthmarks. So something like this which is very disfiguring. Even some time back we had to turn back these people saying that we don't have anything to offer. But now we get marvelous results which is very satisfying to the patient as well as to the treating dermatologist. This is another birthmark which is a vascular type which has again treated with laser. Collagen injections which have been used to use the static lines. You can see the smile line which has been disappeared after the use of the filler.
In my presentation, and so we combine both surgical and non-surgical procedures to improve the final procedures we do, the surgery in the breast, both men and women, and in the abdomen, nose, the body, the face, neck, arms, ears, so you name it. So we do a lot of pressure on the guidance to get these treatments. But I don't know how many of you know that there are patients coming to Sri Lanka from Australia, New Zealand, Middle East countries, do a procedure and get a good result. So therefore, we assess the individual's need and at the same time assess the individual's problem. And then, depending on that,
surgery for photography. and especially I cannot show the faces because except one patient, but expensive. So that is the only thing. But most of the patients, depending on their schedule, because they cannot take maybe 2 weeks off their schedule. So even cost is not a problem for them. So what they want is the final outcome. So they go for a filler. But if I combine, we'll say for example nose surgery or another procedure, then we can inject fat at the same time. So those patients. So depending on the patient's requirements, so we plan accordingly.
Filler is an artificial thing, but fat graft will be on stem cells.
Yes.
What is the lifespan of a stem cell?
Yes.
Does it stay permanently? I
Yes.
have a whole series of questions. The lifespan is number one. What is safer? And then you have to keep refilling the fillers. And fat grafting, does it stay for? And which is safer?
It's like this. So the procedure, either I use a fat graft or a filler, or that is a synthetic thing. I decide on the patient's requirement. We say a very busy person, cannot take even 1 day off, and a small area like maybe a theatre. Involved in this fat injection. It's not just taking some fat and injection. So and the plane you inject and the size you inject. So there are a lot of technical things you have to consider, and we make sure that the product is good. So they are quite safe.
You mentioned about semi-permanent. Can you elaborate on the semi-permanent?
Yes.
What is it?
Yeah, semi-permanent means usually like what we inject at the moment in Sri Lanka is called Restylane or Perlane, or that there are different products in the same, that will last only for about 9 months. There are other products which last for about maybe a year, and semi-permanent ones, they last for about maybe 2 years or a little longer. And so there are a lot of different types of fillers available in the Western countries, not here. So I think that is one problem we face.
Now let's start making appointments to visit the Nawaloka Skin Center. I can assure you of one thing: the moment I get out of this wretched chair, I will be meeting a hasty advance to the Nawaloka Center for tummy surgery, which I think I'm going to need after 2 months of being stuck in this horrible chair. So thank you everyone for coming.
Seven. Oh, she already won.